are joining us this evening, it's likely because you or someone you know, like your child or the students that you work with, are interested in pursuing a career as a respiratory therapist. You might be wondering what the role looks like day to day, what the education pathway involves, and what it's like to practice in a rural setting. I'm very honored to introduce our speakers this evening who are here to help answer those questions and share their experience with you. Jimmy Joy is the academic chair for the Respiratory Therapy program at the Southern Alberta Institute of Technology. With a career spanning diverse areas of respiratory care, Jimmy has worked in intensive care units, emergency departments, operating rooms, pulmonary function laboratories, community clinics, clinical research, education, and administration. His broad experience gives a deep understanding of how respiratory therapists contribute to patient care across the healthcare continuum. And we also have Nyary Onyango, registered respiratory therapist. She is also a certified respiratory educator and a certified tobacco educator out of the Cardston Health Center. With over 11 years of experience, Nyary has built her career as a community respiratory therapist serving rural Alberta. From Fort McMurray to Cardston, she's worked across all health zones, bringing respiratory care and education directly to communities. Passionate about mentoring the next generation, Nyary will share what her day-to-day looks like, what inspired her career choice, and how rewarding it is to make a difference in patients' lives, often right in their hometowns. Thank you, Jimmy and Nyary, for joining us this evening. I will now turn it over to you.
Awesome. Thanks, Emily. I'm just going to share my screen here. So I'm Nyary. I'm not going to get too much into introductions. Emily already did, so I'm just going to go right into our slides. So who are respiratory therapists, or what do we do? So respiratory therapists, or RT as we are often referred to, we are skilled healthcare professionals that help people breathe better. We work with patients all across the board, all ages, with breathing problems or lung problems. And we work in a variety of settings. So that includes hospitals, clinics, communities. So community can be a nursing home, a rehab center, a research lab, a sleep lab, as well as inside patients' homes. So what do we do exactly? We don't have time to get into everything, but I will give you some examples of exactly what we do, okay? So we assess and perform medical tests and provide a wide range of treatments related to respiratory diseases. So when I say assess, we mean assess breathing, checking oxygen levels, checking people's lungs, like listening to their lungs and seeing how well the lungs are working. And based on our assessment, we can provide a wide range of treatments. So that could be anything from providing oxygen therapy, so setting up, adjusting, monitoring the oxygen, and making sure that the patient is getting the right amount, as well as safely. We can also provide breathing treatments, so that's administering inhalers, nebulizers, making sure it's the right dose, making sure the patient is responding appropriately to the medication that we've provided. We can also perform medical tests. So that is lung function tests. We call them pulmonary function testing. And that measures how well your lungs are working. And then we would provide the appropriate treatment based on that, as well as collecting blood tests. We don't do a lot of blood tests, but we do specific blood tests that is checking patients' oxygen levels and other things, and then we kind of cater our treatment based on the blood result for that. The duties of a respiratory therapist really do kind of vary or depend on the setting or where they are working. Hospital work is the most common work that you're going to get a respiratory therapist at, but there are other areas, and I'll get more into those areas. But within the hospital, there are several departments. So you can work in the ICU, emergency room, operating room. You can work in labor and delivery. So I'm going to give you a little bit of an example what each area would do. A respiratory therapist, you could see do. So for example, in an emergency room, we're there to support the airway. So we're usually at the head of the bed, and we are, whether that's giving a breathing treatment, whether that's putting a mask to help the patient breathe, whether that's putting a tube down their throat to help them breathe and setting them up on a ventilator. You can find that's an example what you can find a respiratory therapist doing in an emergency department. So let's say the same patient is now admitted into the hospital because they are on a breathing machine. They are taken into ICU. So in ICU, you'll find a respiratory therapist managing the ventilator. So we do adjusting the settings, making sure the patient's comfortable, if they need to be suctioned, because they're not breathing on their own, they can't really do anything. So we're doing everything for them and managing the machine and working along with the team in the ICU as well. In the operating room, you can do a little bit more education if you want and become an anesthesia assistant, and you can work in the operating room, and you would be supporting anesthesiologist, helping patients breathe basically while they are put under, while they're in a during an operation. And then other areas of work, so community work, for example, you can get a RT working in a sleep clinic. So a sleep clinic is a testing center where a patient goes overnight if they're suspected of having some sort of breathing problem while they're sleeping. So respiratory therapists work there, and they basically monitor the patient overnight and then figure out what it is that they need, what kind of treatment or therapy that they need. You can actually do this type of testing at home now. So there are other therapists who work in home care doing sleep testing as well. And I'll go a little bit more into that later. So in the community, again, you can also work at a pulmonary function clinic, like I mentioned before, and that's where you do lung function tests. Most of the time, you basically have a list of patients and they're coming in and out, in and out. You're doing lung function tests all out throughout the day, basically. And then home care, most of home care respiratory therapists, they're either managing sleep therapy or they're managing home oxygen. And again, I'll kind of get into a little more detailed about that later. Um, we are also educators. So you could work at SAIT, for example, teaching the respiratory therapy program, or you can be a patient educator where you educate patients about their lung disease, how to use their breathing a medication, and to help them manage their disease. An example of that would be asthma. And then another area that you can find a respiratory therapist would be in research. So we are there to either monitor patient safety during clinical trials, recruit patients, collecting data. Most respiratory therapists in research are usually working in medical device companies, so where they actually develop the ventilators or the oxygen devices. So they're there to ensure patient safety and user friendliness of all those machines. So so that's a little bit of a summary of just what a respiratory therapist does. I'm going to stop sharing, and then I'm going to get Jimmy to tell you about how to become a respiratory therapist, and then I'll come back and tell you about my day.
Great. Well, thank you, Nyary, for starting us off here. And I want to again welcome everyone to this session here. So great to see the interest in the program and in the profession. Great. So yeah, there are two institutions in the province, only two institutions in the province that offer the respiratory therapy program. So we have NAIT in Edmonton and SAIT in Calgary. And so I look after the respiratory therapy program at SAIT. And as you're starting to hear from Nyary, it's can be a really fulfilling career for many folks. Respiratory therapists do tend to stay on in their careers, which is a good sign. And the programs both at NAIT and SAIT, NAIT has a really good program as well. They are focused on hands-on learning. So, starting on your first semester itself, people are actually doing hands-on, in labs and getting into practicum. So it's really quite interesting. To even the learning process is really interesting. And then employment demand. That's something, when you're investing in education, you want to make sure you're in a program that you can get a job for, and especially, well, maybe some things you can thank the pandemic for is respiratory therapy became quite prominent because respiratory therapists were sorely needed in the kind of peak of the pandemic to help all those folks who needed that support, right? Now, as far as the program structure is concerned, it is a 3-year program, so it's a 3-year diploma, and there are 60 seats in the program at SAIT. How the program is structured is that the first 2 years are primarily on campus, where you learn theory courses in classes and a lot of lab work, pretty good amount of lab work as well in the first 2 years. Both first and second year do have practicum. So our students go out to hospitals and home care, different settings, all the settings that, not all of them, but many of the settings that Nyary was talking about. Students get exposed to that in the first and second year. And then in the third year, it's almost all practicum. Most of the third year is practicum. And the third year is a full 11 months. So it goes from the end of May or early June until the end of April the following year, right? So it's the program at SAIT has one of the longest practicum years in the country. Programs have different lengths of practicum, and ours is one of the longer ones. And we hear from the employers that students are really well prepared to work because they're getting that much exposure in the clinical environment before they graduate. So that's one of the strengths of a program like this. And as far as practicum is concerned, students are placed across Southern Alberta mainly, but from our program, and then Northern Alberta if they're in the Edmonton NAIT program. So there's everyone who comes to SAIT does have at least part of their practicum in Calgary because there are some specialties that are only available in the bigger centers like Calgary and Edmonton. So they spend at least some of it there, and then depending on where they're placed, they might be in Lethbridge for a part of the year, or Red Deer or Medicine Hat. Those are right now our clinical sites. So for the last few years now, 100% of the students who graduate from SAIT report that they are employed. So we do a survey 7 months after they graduate to get this kind of data. And you can see on the screen, the starting salary is close to 82,000. That's, within 7 months after graduation. So really, really, good career to get into, and you can really quickly pay off your student loans and everything. And I'm sure Nyary can relate to this. It's not hard to get overtime if you want it. So that's, certainly earning potential is there, right? And then our program, something you might be interested in quite a bit is how to get in. What do you need to get into the program? So you need 70% in these courses. So Math 30, Math 31, English 31, Chemistry 30, and Bio 30. So those are the requirements that you need. And 70% is the cutoff. It doesn't matter if you after 70%, it doesn't matter if you get 75 or 95, you meet the admissions criteria, right? So it's not competitive based on your high school marks, but it is competitive based on how you do an entrance test. So there are 2 entrance tests that you need to write. And then the people who score highest on those entrance tests are offered admission. Okay, and I'll talk about the entrance tests in a moment. But for timelines, our applications opened in October. So every year it opens up in October and they close typically in March. Okay, so it is still open. If anyone's interested, you still can apply. And this year, this is the first year we're doing this. We wanted to see if we can increase the number of students who are interested in rural placements and hopefully working rural as well. So we now have seats that are reserved for non-Calgary applicants. Okay, so this is brand new, and we're trying it this year and seeing how that works. So there is also a pathway for our non-Calgary students to get priority in certain seats. Okay, so that's something that I wanted to make sure you're aware. This is new, and you're the first group we're talking to about it. Now, getting into those entrance tests. So the first one is called Casper. And Casper is a situational judgment type of assessment. So it's got 11 questions, and there's different types of responses. So it could be, written response or a video. And so some of them, typing, some of the answers you'll need to type, others you might be a video response. And it just asks questions, related to how you might do in a certain situation. Okay. This test costs $50 for this particular test. And then this test is used across multiple programs at SAIT. So if you are applying to more than one program, you just write the test once, and then you just pay a fee to have it sent to each program that you write. And it can only be written once within one academic cycle, one admission cycle. It's written once. So that's the Casper test. And then the second test We call it the profession-specific entrance test or entrance assessment. This one is really based on your high school learning, right? So it covers things like reading, math, science, a little bit about what you learn about the profession. So things that you can learn online to see what a respiratory therapist does and is. And attending this session itself will give you some of that knowledge. So you're ahead already of the people who might not be attending this session. And then once people write these tests, these scores, they're scored automatically, and then they get sent to our program. These are external tests, and they get sent to our program. And then they're ranked, and the people who score highest are offered seats. We do have a 2-cycle admission process where one set of offers of seats of admission goes out in December. So just last month, the first set of offers went out. And then the next set of offers will go out, the second and hopefully final set of offers will go out around Valentine's Day, so mid-February. Okay, so anyone here who's interested, if you apply now, if you're successful, you can expect to hear in mid-February about whether you're being offered a seat. Okay, this particular test, the second test, profession-specific entrance exam, costs 25, and that's US dollars. And this one you can write as soon as you pay the fee, whereas Casper is only offered at certain time points. About once a month is how often that one's offered. Okay. Now the program at SAIT has some distinct advantages that's worth highlighting. It is recognized by the certifying bodies, both provincial and national. And we have an additional standard with Accreditation Canada. So our program is accredited through Accreditation Canada, and it's received the highest level of accreditation, so 6-year accreditation. And the regulator in the province is called the College of Respiratory Therapists of Alberta, so it's approved by the college as well. And this last year, there is a national exam that students need to write after you graduate from the program. And you write that national exam, you have to pass that, and then you can apply to the college in the province where you want to work, and you get your license to practice. So both Nyary and I have a license, and so we can call ourselves registered respiratory therapists, right? Because we've written the exam, we've passed, and we're licensed in the province. Last year, among all the people across the country who wrote that exam, the person who ranked number 1 in that national exam was a SAIT grad. The person who ranked number 2, silver medal, SAIT grad. Guess who the bronze medal was? SAIT grad. So the top 3, in the national exam were SAIT grads across the country, right? So that kind of gives you a sense of how the quality of the program and the standard that the program at SAIT and NATE has a fantastic program as well. So you can't go wrong going to either of these institutions. Okay, so just to give you a sense of how well, what you might look forward to. Okay, and then beyond the classroom, there's lots of our students. We just have fantastic students. They run clubs, sim club. We even had a group running a beekeeping club at one point on the roof for one of our buildings. It was a lot of fun. I was scared to go up there, but my instructors were much braver than I am. But lots of fun things that people get involved in. Our program for many years hasn't had this, but there are some programs that have study abroad opportunities. And then they have, interprofessional events where we get, physiotherapists and social workers and nurses and physicians, coming together to do educational events together. So lots of things that students do outside of our regular classroom to get involved, both in the institution and in the community. And then, taking a step into post-secondary education can be big. For some folks, it might be the first time you're stepping into something like this. So know that there are some really strong supports that are available for students. So we have our Accessibility Services Office, which can help you apply for, learning needs if needed, or equipment loans, finance, that sort of thing. Sometimes some of our students need additional testing support, so that's available. Counseling, coaching, right? So a lot of supports that are available, and we find that people who tend to access the supports early tend to be really successful in our programs. And then as far as I'll just leave you with some contact information. So if you're interested in learning, if you have questions about admissions related to the SAIT program, inquiry@sait.ca is the email you would send. And then anything about the program itself is the second email that's on the screen. And then the first place I would recommend you go to is our website. Okay, so the SAIT website, and if you search for respiratory therapy, you'll get to our program page, which has a lot of good information about how to get in, when to apply, what courses you're taking, what uniform you need. All of those things are on our website. Okay, so that's really the first place I would go. And then if you have further questions, you can contact either of those two emails up there. Okay, so I'm gonna stop sharing my screen and hand it back to Neri.
Thanks, Jimmy. That was awesome. So I just wanted to talk to you about just a quick background on how I became or what motivated me to become a respiratory therapist. I know choosing a career can be a difficult decision. Some people already know what they want to do, they've always known, but for some people, they're still trying to figure that out. I think I was one of those people in high school. I just didn't know what I wanted to do when I finished high school, but I knew I wanted to get into the healthcare field. I just didn't know what exactly I wanted to do. So I went to university actually first, and I pursued a degree in biology before I went to our RT school. So I got a degree in biology and gerontology, which is the study of aging or older adults, before I actually applied to RT school. But why did I choose respiratory therapy? So, how I found out about respiratory therapy is I'll give you a quick kind of background, but I'm a runner. I like to run. I enjoy running, put my headphones on, take my dog out. It's very relaxing. I just enjoy doing that. But when I was younger, I always had a hard time with my breathing. And it was always at a specific time, like during the fall weather, where I'd go running and I just have a hard time. Either I'm wheezing or I'm coughing for days on after that, but it would go away. But I never thought anything of it. I never thought I had asthma or anything like that. So when I went to university, my second year in university, I joined a running club. And school starts in September, so the running club started in October, right? And that was fall weather. So we ran, and long story short, I had an asthma attack shortly after that. And that one was pretty bad. I ended up going to the doctor and getting an inhaler. And he basically said, I think you might have asthma that's induced by exercise. Really didn't know what that meant. Didn't really explain very much to me, but I just said, okay. So he said, use this inhaler, it will help. And for sure, it did help. So I did avoid running in the fall weather sometimes, but when I used the inhaler, it was helpful. It was great. So I said, okay, this is fine. Fast forward, I finished my school and now I'm looking up different careers, and respiratory therapy was one of them I looked up. And I was kind of like, huh, I didn't know somebody does that. I didn't know you can be tested to see if you have asthma. I didn't know someone can actually teach you about asthma, how to take your inhaler, what's actually going on in the lungs, how to take the medication, how the medication actually helps me, what to do in an emergency. Like, I didn't know that. So I thought to myself, it would have been nice if I was referred to somebody like that, if I was given the chance to talk to somebody to walk me through what asthma truly was. So I said to myself, maybe I'm going to be that person for someone. So I applied to respiratory therapist school and I got in. So why rural? I'll give you a little bit more background on my career, I guess. But I went to school in Ontario actually, and the school process is pretty similar to what Jimmy just described to you. 2 years and then 1 year of full clinical. So when I graduated, I worked at the hospital that I did my practicum at. And then I moved to Alberta because my family was living in Alberta. I just wanted to be close to family. Alberta has been so kind to me. I've been here since 2014, and I've had the greatest opportunity to work in several diverse areas within Alberta. So hospital work was nice. It was 12-hour days though, so like it's shift work, right? But you got to learn a lot. So you did pretty much the full scope of your practice in hospital work. And I can't speak for every hospital, but the hospital that I worked at, you get there and you basically have a pager, and there's different departments that you can work through. So like I was explaining, there's ICU, emerge, labor and delivery. So for example, if I was given the pager for emerge, I'm answering calls for emerge that day. Doesn't mean I can't support my coworker. It just means I'm kind of primarily responsible for emerge calls. And then ICU, same kind of concept. So, and then labor and delivery, I could be called if a baby is born premature, for example, their lungs are very underdeveloped. So they usually need a respiratory therapist there to help them kind of transition. So it's very fast paced work in the hospital and pretty adrenaline driven. So if that's the kind of person you are and you enjoy that kind of work, then hospital work would be something for you for sure. I did also work in home care. So after um hospital work, I moved on to home care, and I did home care for about 5 years. And what home care truly involved was mostly oxygen therapy or home oxygen therapy and sleep therapy. So, for example, if the patient was in the hospital and they were on a ventilator, everything is doing fine, they got off the vent, they're feeling better, everything is doing well, except they just need a little bit of oxygen. You can actually provide oxygen at home. The government will pay for that. There's funding criteria for that. So, you have respiratory therapists who will follow up with that patient at home and set them up with the oxygen, show them how to use it, show their family member how to use it, do an assessment at home, make sure the oxygen that they were prescribed is appropriate and good for them. Sometimes the change between just some simple as like sitting versus walking, because when you're walking, you're using a lot more energy. So sometimes you need a little bit more oxygen. So we advise the patient on what they should do. We'll do that assessment at home initially, and then we follow up on them. Some patients can be on oxygen just for a few months, just they needed that time to just recover and get better. And some patients can be on oxygen for a lifetime. It all depends on what's going on within their lungs. So we'll follow them. So home care work is pretty much day shifts, right? So you're working 8 to 4, 7 to 5, whatever the company is. And there's several different home care companies within Alberta. I think in Lethbridge, I'm in Lethbridge, but in Lethbridge alone, there's about six home care companies that you can work for. And it's like I said, 8 to 4 or 7 to 5, but you do have to be on call. That's one thing you do have to deal with home care. So, and partly for two reasons. One is they have machines at home. They usually have a backup machine, but sometimes something goes wrong with the machine. Breathing is kind of important. It's a big deal. It's an emergency. So you're gonna have somebody on call to swap out the machine or make sure that they need something new or whatever is going on. And that could be at 10 p.m. at night. That can happen, right? So, and then another reason is discharge. Discharges can happen from the hospital at 7 p.m. On a weekend. We can't just say, oh, the home care company is closed, so you can't go home. So respiratory therapists will be on call for that to set up the patient on oxygen during the weekend or after hours or anything like that. And then in home care as well, sleep therapy is another part of what we do. So we're involved in basically testing the patient. So we provide the equipment, how to use it. The patient goes home. They kind of set themselves up to check what the oxygen levels are, if they're breathing okay at night, and then they'll bring back the machine. It usually records. It will record everything. We'll download it, check that the data is okay, and then send it over to be interpreted by a lung doctor. And then after that, depending on what they need, most of the time it's sleep apnea that they have, which is essentially you just kind of stop breathing in your sleep. You don't stop for a long time, just for 10 seconds, and then you breathe again, and then you stop again. But that's not really good for your heart. So we can treat that with a CPAP machine. So we can set up the equipment, show you how to use it, monitor, do the education, and then follow up as well. So that's kind of what home care RTs would do. And that's just two of the examples I would do. We can even have home care RTs managing patients who do have ventilators at home, and they can support those patients as well. But after my home care experience, I kind of moved on to rural work. So that is when I moved to Fort McMurray. And in Fort McMurray, I was a respiratory educator, so a patient educator. And there, I basically supported a big team of healthcare professionals. So we had a doctor, a nurse, a pharmacist, a mental health therapist, dietitian, basically all the disciplines that you can think of under one roof. So if the doctor was to see the patient and they thought, well, they need to see Nyary for their asthma, for example, then I would either do a test to check if they actually have asthma, or I'm doing education to educate them how to use the inhaler, or what is asthma and how do you manage it, which is exactly what I wanted to do when I chose this career, right? So that was right up my alley there. And you also got to do a lot of work with just like the other professions. So another area that I also do is tobacco cessation, which is basically counseling on how to quit smoking. Um, I don't really prescribe any medication, but I could bring in the pharmacist, for example, into my appointment, and the pharmacist would talk about the medications that the patient can take in order to help them with quit smoking, whereas I was helping them with the behavioral changes on quitting smoking. So it's get to work very closely with your team. Even though I was the only respiratory therapist in that team, I mean everybody else was also their own. There was only one pharmacist, more on mental health, but everybody worked together to kind of support the patient all throughout. Um, and within that same clinic, I also ran a program that we call pulmonary rehabilitation. And pulmonary rehabilitation is basically an exercise program that is for specifically for people with lung conditions or lung disease. And it runs typically for 8 weeks. Patients come 2 to 3 times a week and for about 3 hours ish at a time. And 1 hour is allocated to education. So that's where I come in. So for that education, I'm either doing a specific topic. So today would be about breathing exercises. So we talk about breathing exercises, and then the other 2 hours they're doing actual exercise, and the exercise specialist or physiotherapist will be working with the patients because that's their specialty, right? And I'll be there to just monitor the patient, make sure that the oxygen levels are doing okay, if I need to adjust the oxygen levels that they are on, and kind of basically teach them how to be able to exercise far beyond the program itself. And it's so rewarding because you get to see somebody from the very beginning on week 1 and the difference that is made in week 8, right? You don't necessarily think about exercising, especially when you have a breathing problem. Most people, I'm short of breath. What do you mean I can exercise? That doesn't make any sense. I can't breathe, right? But exercise actually helps to strengthen your breathing muscles or your respiratory muscles, which means you can feel less short of breath over time, right? So it's a very important thing to do. So we do a lot of teaching as a respiratory therapist, and then work together with the physiotherapist to get the patient from where they're starting to all the way to the end. So I did that for about 2 years before I moved back to my current role, which is a community respiratory therapist. So community respiratory therapy is a little bit different from a big hospital. And the biggest difference I would have to say is just it's not as fast paced or as adrenaline driven as as a bigger hospital or a big city hospital. Partly because most community hospitals don't have very many departments. So they won't have an ICU, or they won't have an operating room or the delivery room. Most of the hospitals, at least the ones that I worked in, and I've done community work in the central zone, so Drumheller area, and then right now I'm in the Cardston, Lethbridge area, and it's very similar. Um, in most of the work that I do, or the hospitals would have a emergency department, and then a inpatient department, and then maybe a long-term care department, which is usually like a nursing home, basically kind of attached to the hospital. So you don't have very many. So you don't have, like I said, the fast-paced environment of a bigger hospital, but you still get to do the full scope of your practice, and simply because you're actually the only respiratory therapist there. And how the role usually goes is you actually cover more than one hospital. So for me, I have 3 hospitals that I cover. So I basically just go between those 3 hospitals during my week. So I'll do 2 days at one, 2 days at another, and then one day at another. And I just pretty much alternate those days between the hospitals. I try to keep my days pretty consistent just so that the staff is has somebody consistent on a specific day. But I don't necessarily, I'm not always there all the time, but because you are the only person there, you kind of have to know everything. You kind of have to support them with every single part of whatever respiratory issues that are needed basically for a patient. So I'll kind of go through a little bit of a day in my life. So my day starts off with driving. So community rural respiratory, you have to do not love driving, but you do have to drive a lot. The hospitals that I work at, they're about half an hour from each other, but I get a fleet car, so I get a company car, and I get a gas card, and I also got drive time for that. So if my day starts at 8, I have drive time for half an hour, and then my day actually starts at like 8:30, 9 o'clock by the time I set up everything and see my patients. But it basically starts off with me kind of looking at my calendar because I get patients, outpatients, or patients basically from clinics around the area that I'm working at, whatever town I'm working at, the doctors and the clinics there will send a referral to me. And so those are my scheduled patients for the day. And then inside the hospital, I might get some referrals for people who are actually admitted. And then I also get some incoming faxes, phone calls, that kind of stuff. So I usually start my day with looking at everything that's coming through, and then I prioritize based on that. So I got to see what's more urgent than that. If I need to shift around my schedule, then I do so. But that's kind of how my day starts. But for outpatients, what I'm mostly doing with outpatients is either breathing tests, education for things like asthma, checking how to use the inhalers, that kind of stuff, smoking cessation, so tobacco counseling, as well as blood tests. So like I mentioned, when people are on oxygen for a long time, we do assess the blood work to make sure that they still need the oxygen, or if they don't need it anymore, we usually can tell by blood work. So I do blood tests as well on that. So that's most of what my day looks like on the outpatient side. On my inpatient side, I'm mostly there as a consult. So remember, I'm only in this hospital twice a week, basically, right? Because I'm only there 2 days a week. So I'm not there all the time. So the nurses there, they're going to be the constant for that, for the patients that I work with, or the patients that I admitted, I guess. And I'm just there mostly to support those nurses. So I'm there to educate them so that if they do run into a respiratory concern with a patient and I'm not there, they know how to, they're equipped and they're ready. They know how to actually manage the patient on the day that I'm not there. So I'm there mostly for support and education of the nurses. I do get referrals. So, for example, if they do have somebody who is actually going home and Mr. Smith needs oxygen, I will do the blood test. I will organize all that for the patient to actually get home and and then connect them with the home care community respiratory therapist. Or, for example, if they say, Mr. Smith is going home today, but we just wanted you to run through his medication, make sure that he's doing okay, that type of stuff. So I'll do a consult on that. I do go to emergencies, not very much, but I do. Like I said, I'm not always there, so they're pretty well equipped in knowing how to handle those situations. But if I'm there, it's nice to have a helping hand and expert to be there, right? So I do go to emergencies to help with patients in that area. But I really do enjoy working in rural. It's so nice. You get to kind of be the the expert. You're the skill. You're the know-it-all person for respiratory wise, at least. So they really do value your opinion. They value your skill. They value your knowledge. Everybody there is, the doctors get to know you. It's rural is very small hospitals, like, oh, it's the same doctors all the time. They get to know you, they get to know you, get to know them. But everybody really, really does value what you do. And you, like I said, you really do get to maximize the full scope of your practice because you are the only person and you're doing everything. And every day is not the same. Everything is different. You get to kind of touch base on every little thing. So before I leave, I'm just gonna give you a couple things that I would say makes a good respiratory therapist working particularly in rural. Um, you have to be very independent. You are working by yourself, like I said. Not only are you the only therapist there, but you're also sometimes working with very limited resources. And what I mean by that is they are smaller hospitals, so we don't have all the equipment and everything else that we need. So you often have to really think outside the box, think on your feet, and be able to problem solve is a very big one. You also need to be able to prioritize your workload. Like I said again, you're the only one there. So once your day starts, you gotta be able to prioritize and be able to shift gears at any moment of what's on the day. It's very important to be very self-driven as well. You are, sorry, my lights come up. You are working alone. Um, and my manager, for example, works about 2 hours away in a different town. So you have to be really a self-driven person and be a reliable team member because that hospital is relying on you to be there. So if you say you're gonna be there on Tuesday, be there on Tuesday. And nobody's there to check on you and necessarily, right? But you just have to be part of a good team member. So be a good team player, be approachable, be willing to help, independent, and be very self-driven. The pay is very nice. Um, Working in rural also gives you a lot of flexibility with work-life balance because the days there are 8 to 4, at least for me, they're 8 to 4. There is no on call, there is no weekends, there is no nights. So it means, but that also means that the pay is also set though, right? Because you can't really pick up any shifts. So if you want, you can get another job if you really wanted and work like at a hospital and pick up shifts there, but for rural work you can't really do that, so there's not kind of that opportunity to do that. But lastly, for anyone really considering the program or RT, honestly, the program is great. The educators are amazing. They're very helpful. School really does prepare you for the job in real life. I personally found school to be very manageable, and I don't know if it's because I already had a degree in biology, but I found it to be very manageable. Everybody was very helpful. What I did maybe find a little challenging was the clinical portion. I think it's just the transition from like paper and real life is a little bit different, right? But the preceptors are really nice. They are there to help you, they are there to see you through, they want you to succeed. So, a couple of things that I would say: be willing to learn, be very humble, practice makes perfect, and be willing to learn from your mistakes, and you will do just fine in the program. And that is it for me. I will stop sharing. And these are just, I'm sorry, some pictures I wanted to show you guys. So this is me doing a blood test, see how check the patient's oxygen levels. So when we do blood tests, we do specifically what we call arterial blood tests. Whenever you get blood taken, it's usually from a vein, but we take it from an artery. So this is an arterial blood test that I'm taking over here. And then based on his numbers, we can decide whether he needs oxygen or not. And then this is me running the blood sample here at the lab. Depending what hospital you work at, you can either hand over the blood sample and the lab will run it for you, or you can run it yourself, and I can run my own lab. So I just do that. And then this is me in my office doing a breathing test on somebody over there.
Thank you both for sharing your wealth of knowledge with us this evening. We will now open up for a few minutes of questions. I do have a few questions just to get us started. What advice would you give to someone who's just starting to think about a career in respiratory therapy?
I would say, honestly, it's a very, very like meaningful career. If you're somebody who just wants to help people, this is an amazing job. And breathing is so basic, you don't really think about breathing, but when I always say, when you can't breathe, nothing else matters. And it's nice to be that person to help a person in their crisis when they really don't know what else to do, and you are present, and you get to see kind of the direct effects of what you're doing. And it's very, very rewarding. Like there's not a day that passes by that I go, oh man, I wish I changed careers. Honestly, I think I'm set.
Jimmy, do you have anything you wanted to add to that
Yeah,
question?
I'm wondering, I might just offer some clinics, hospitals offer, job shadowing for people who are just looking to explore the program. And especially, if you've heard what Nyary does in her day, and you might be interested, say, wow, I'd like to spend a day with Nyary and see that. I don't know, Nyary, do you offer that with your?
Yep, we do.
Yeah. Yeah, so that might be an opportunity for anyone who just wants to see, like, see what it's really like and experience that in person. That's something to really try.
Are there opportunities to specialize as a respiratory therapist?
So there are. So if you might remember, one of Mary's slides was the operating room. So there are some areas where so going to school trains you in the scope of practice of a respiratory therapist. So there are some competencies that are required that everyone who graduates from the SAIT program needs to know, will know. And then you learn on top of that. So in specialized areas like the nursery, for example, so if you're working with babies, or if you're working in the operating rooms, there's often you go into that area and you're able to work as a respiratory therapist with your diploma and your registration. And then they have training for the first, sometimes it's weeks, sometimes it's months, depending on where you're going, to get that specialized training. So you specialize in that area. And then there's also additional education. So there are certifications you can get. So there's the anesthesia assistant certification, which is increasing every year, and that specializes you in the operating room. There's a certified tobacco educator, certified respiratory educator. Both Neri and I have those certifications. Um, and then, there are cardiopulmonary technicians. So there are kind of branches of specialization that you can get into. And I think that's one of the beauties of this particular profession is that, you get a broad education that you can do most anything. And then there are you can specialize into certain things depending on what your interest is. So if you're looking for often students after they graduate will go into a hospital first because you get a lot of experience and specialized experience. And then after you work a few years or so there, you kind of realize, yeah, this is great. This is what I want to continue doing this. Or you might say, you know what, I'm starting to have a family maybe, and the nights aren't working out so much. I'll need to have more time during the day or during the evenings with my family, for example. Then you can go into some areas that have that type of shift, right? So you can kind of base your journey on your interests. So there's quite a bit of opportunity that way.
Another question that came in, there's two parts to this question, so I'm just going to start with the first part. How intense is the respiratory system program compared to other programs?
It is quite an intense program. So I do want to, for folks who are coming in, know that it is an intense program. There's a lot of study involved. Um, and we get students with different backgrounds. So you might get someone who is straight out of high school. We do get students like that. And then we get students who have some post-secondary education, some with degrees, some with master's degrees. So it's a big, range of people who come in. And everyone then needs to get to the same standard by the time they leave the program. So it is quite intense, but having said that, it's also doable. So, if it's something you're really passionate about, then just, budget the time and the energy to give, to take the courses, to really delve into the learning and then access the supports that are available and people will get through. The people who there's very few people that are unsuccessful. We have pretty high retention rates. But the folks who are unsuccessful invariably tend to be folks who maybe weren't completely committed to it and so didn't put in the time to really, take advantage of everything that's offered.
And the second part of that question is, what is the most challenging part about being a respiratory therapist?
I think the probably the most challenging thing is the agency of like breathing, because breathing is life, right? So when something goes wrong with breathing, it is an immediate thing. So there's a little bit of pressure and expectation of you, but this is what you are trained for, right? But you are kind of prepared, you are expected to be calm, think clearly, and act fast in like very high stress situations a lot of the time. So that can be a little bit intimidating, but honestly, school really does prepare you, and practice, the more you see something, the next time it kind of comes around, you'll be more prepared for it.
And Nyary, what do you enjoy most about being a respiratory therapist?
Seeing my work and seeing people actually get better after after they have seen them at kind of their worst moments. So you get to make a very positive, meaningful impact in people's lives. And they are very thankful. And especially for rural, I get to follow people quite a long time. It's not the same as working in the emergency department. You don't get to know what happened, I guess. But with rural, because most of the patients I'm seeing, they are more like a chronic kind of disease patients. They have asthma, but they've had it for a long time, or they have COPD, which is a disease you get from smoking. So I see these patients quite often and I get to know them. And working in rural, you get to know people all the time because they live in the same community you're working in, that kind of community too, right? So it makes a very meaningful impact, honestly, on people, and you get to see what you are actually doing years later.
And just one question for Jimmy. If you have the minimum grades while applying to the program, are there any other factors that will be considered in the selection process?
Yeah, great question. We do get that quite a bit. So yeah, once you have the minimum requirements, the only thing that's considered, well, two things. The only two things that are considered is the entrance test, how you do on the entrance test. That's the biggest factor. And then the second thing, which started this year, is if you commit in the application process, there will be questions about, are you interested in committing to a placement outside of Calgary? So that is the other aspect that will bump your, application up. So once you have, but most of the time people are asking, well, if I have a master's degree, or if I have a degree, or if I have post-secondary education, does that help? No, it doesn't for the for the program. You meet the minimum, and then it's only entrance tests or non-Calgary placements. Are you looking for those?
Thanks again, Jimmy and Nyary. We really appreciate the time you took to present to us this evening, and I'm sure you've inspired a few students joining us to explore a career in respiratory therapy.